The federal government established a public access policy in 2013 for scientific research. It allows journals 12 months of exclusive access to an article before making it publicly available. This policy was recently updated in August by the White House Office of Science and Technology Policy, or OSTP.
It calls for agencies to prepare plans for updating any existing policies that they have to ensure that publications are made freely available to the public without embargo following publication, and for the scientific data underlying those publications and perhaps other data as well to be made available as well. So in essence, to optimize quick sharing of publications that result from federally funded research as well as the scientific data.
That's Dr. Jessica Tucker, the acting deputy director of the Office of Science Policy at NIH. She says this updated plan doesn't just help scientists, but the general public as well.
This is increasing transparency and access to results from federally funded research, whether that be participants in clinical trials or other patients who are interested in the latest information about their research, in the latest information about health, or any interested party. I think removing this embargo period will really enhance access to that information. We also think that this is good for science because immediate access to publications that result from federally funded research can accelerate the pace of science.
One example of this is the research done on COVID-19. In March of 2020, a group of industry leaders, including the OSTP and NIH, collaborated to ensure that all research relating to COVID were freely available without any embargo.
By the end of 2022, more than 300,000 such publications were available in our repository, which is called PubMed Central, and had been used to both inform research and public health responses to the pandemic. And as we all know, it was approximately 11 months from the isolation of the first SARS-CoV-2 sequence to people being able to get vaccinated. And this is 10 times faster than average to develop a vaccine for a new virus.
Tucker says the data sharing and immediate public access were crucial to accelerating the timeline. But with so many researchers already having access to journals through university libraries, will this new policy make a real difference?
It's not just a small group of scientists that are always looking for this information. And there's plenty of evidence that suggests that informed patients and informed participants in health are good for healthcare, are advocating for their own health decision-making. And so I do think it's valuable for both scientists and members of the general public to have quick access to this information.
There are currently two major avenues of publishing: traditional and open access. Traditional journals have access fees in order to read the published research. Consumers can buy a yearly subscription or purchase single articles at a time. And though universities are able to negotiate a set price for a bundle of publications, a 2014 study in PNAS shows that these schools still spend millions each year. And Dr. Walter Mathis says the fee isn't something all schools can afford.
Then you get this weird hierarchy between academic libraries. There's some libraries that, like here at Yale, that can afford everything. Where I went to medical school back in Arkansas. There were journals I couldn't get. I'd have to email my friends who were at other schools to see if their school had a subscription to it because it just wasn't in their budget, that kind of thing.
Mathis is an assistant professor of psychiatry at Yale School of Medicine. He says the rising costs of traditional journals helped spur the idea of open access journals. They were created in the early 1990s to provide scientific research free of charge. During that time, there was rising concern that important research was going unpublished because the topics weren't exciting enough to drive revenue for traditional publishers.
Those are hard to get published in kind of because they're a little bit less exciting, you might say. Or along the same lines, studies that confirm somebody else's previous finding, who are completely novel. But you can understand why those would be incredibly important studies to know. Those kind of cases, kind of orphan cases or reproduction cases or negative finding cases, were the real impetus behind kind of open access stuff, because it would ideally create a space where those could find a home. And then the economic side of it, or the kind of the capitalistic side of it, kind of came along later. Again, I think, as my understanding is, journal prices just went astronomical.
While traditional publishers can make money through advertising and subscriptions, Mathis says open access journals have to get creative. Instead of charging the consumer, many open access publishers make researchers pay an article processing charge.
Open access journals do have advertising, online advertising, but they don't have any subscriptions. So they have to offset their production fees by charging the researchers to publish. Those fees range, just in my personal experience, have ranged from the cheapest one being $900 to publish one paper to $3,000 to publish another paper. And there are fees higher than that that have to deal with, but substantial fees. These are for one paper in one journal at one particular time.
The good news is that many big research grants set aside money specifically for these types of expenses. Unfortunately, Mathis says authors without a sufficient grant often have to pay out of pocket to get their paper published. These fees have helped make scientific publishing a lucrative industry in America. In fact, Mathis says a large chunk of journals are owned by one of just 5 major publishing houses.
I think it's 50 to 60% are all published by just 5. And Elsevier is by far the biggest of those. And I think it alone has something like 3,000 journals that it manages or that it publishes. So big things like that will be able to function at scale and figure out how to keep themselves afloat. They also have some of the highest profit margins of any business model in America.
In 2010, Elsevier's publishing sector reported profit margins that were higher than companies like Microsoft, Coca-Cola, and even Google. The Association of Scientific, Technical, and Medical Publishers' 2021 report estimates that the global market will reach $28 billion in 2023.
Academic publishing is very different than like Sports Illustrated, right? Academic publishing, if you think about all the steps involved and what's paid for, what actually costs anything. So content creation is something that I happily create for free, right, as a researcher, because almost everything about my career is really driven by my number of peer-reviewed citations on my CV.
Meaning that journals get free content, which is usually a main expense for publications like magazines and newspapers.
Editors for these academic journals almost always work for free or very, very low pay because for the same reason, because being an editor of a journal is very, very prestigious and something that really, really will help in their promotions. And it tends to be people who are in associate or full professor level. You know, it's a really big kind of attaboy type of thing that they really want. So they're basically donating their time. Quality control or peer review, which I've never been an editor, but I have been a peer reviewer, a peer. So it's also done for free.
Because it's another needed experience for a scientist's resume. And in today's world where the internet seems to rule all, many journals don't print a hard copy, opting to publish completely online. Mathis says the only true costs of these publishers are website hosting fees and employing roles that do design work, like graphic editors.
To make you, the consumer, then go and pay to get access to something that really was predominantly paid for by most likely federal funding, was a bit of an odd double or triple taxation anyway. So offloading that cost, the excess costs, back to the publisher or the producer side versus the consumer side does make sense from kind of just a fairness side.
Unfortunately, this new policy will take time to be fully implemented. The OSTP requires agencies to fully update their public access policies by December 31st of 2025. And though this will increase public access, Tucker says it's important to note this policy doesn't require open access.
So what I mean by that is it is not presuming or requiring a certain type of business model or anything like that, right? It's simply requiring that this be made available by agencies who are funding this work quickly upon publications.
One example of this is an agency immediately releasing a version of the research that isn't the final copy.
It can be kind of what often is referred to as the author-accepted manuscript, right? So the manuscript that is the final text, but doesn't have all the final formatting and things like that. So one thing that one could imagine is that NIH makes available that version of the article, but perhaps a journal still maintains a longer embargo period for the final publication. And then obviously, ultimately, that would then replace that earlier manuscript. But again, the bottom line still is maintained, wherein the final manuscript will be made publicly available under these policies.
That's not to say this situation will happen. It's just a possible way an agency may choose to implement OSTP's policy. Mathis says that even if a majority of the public doesn't take advantage of this access, it's important that research that's funded by taxpayer dollars is available, much like the census.
Not only is it incredibly valuable, but you've already paid for it. We've already paid for it. So to make it inaccessible is just wrong. And so they do a great job of that. And I think this is just in the same vein of you've already paid for it. I don't know what you're going to do with it. Do something amazing with it, but it's already yours. And so there's no reason to let some private international company profit off of US funded research read by US citizens is a little odd.
It also helps to create equal access of knowledge throughout the nation, regardless of economic status.
Opportunity is not uniformly distributed in the United States, but genius is. I mean, who knows what amazing minds we've lost to coal mines and, these kind of places where access and resources and even just conceptualization of a bigger world, kept great opportunity from being developed within individuals. And so there is something beautiful that I do believe in about really important research being accessible by anybody and spawning kind of somebody from the outside of the really established research ranks doing something really amazing.
You can find more information about Drs. Jessica Tucker and Walter Mathis on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
A lot of people thought, oh gosh, there's this narrative of more and more women dying during childbirth. And while that's part of the problem, a big part of the problem is that people are also dying later in that first year postpartum.
Why are more and more mothers dying in America?
Then how experts help first responders overcome their PTSD.
It's not that I'm crazy. It's not that it's abnormal. I'm a normal person having a normal reaction to an injury that was sustained in an abnormal event.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I woke up with all of this extra stress that I could actually feel in my body. And so for me, it was doing that intense, short workout.
The quick changes you can make to better handle stress this year. Then,
what they were able to do, unfortunately, was use weapons to have a physical attack on the power grid, which unfortunately did cause an outage in North Carolina.
Understanding the rising number of attacks on our nation's power grids. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.